Namaste, good evening. Good evening, everyone. A very warm welcome to all of you for this class. Myself, Dr. Pratibha. So let us start with today's class. It's already 12th day of the course. We have discussed about some general topics, or I can say the basic concepts of Ayurveda. और इसके बाद हमने डिस्कस किए हैं कुछ डेली रेजिमेंट, हेल्थ मेंटेनेंस, दैट इज स्वास्थ्य स्वास्थ्य रक्षणम, इसके बारे में डिस्क्रिप्शन. And now we have reached the stage where we are discussing about diseases. So all said and done, the thing is basically how do we treat ourselves naturally, और क्या precautions ले सकते हैं, फूड में क्या क्या चेंजेस कर सकते हैं. All these are important, right? So आज का टॉपिक है lifestyle changes, that is जीवन शैली. Because of the wrong lifestyle, what are the diseases that we encounter? At the same time, what all do's and don'ts we need to undertake, and then how we can be healthy. Okay, so let me start with today's class. Lifestyle disorders. When our lifestyle gets disturbed, lifestyle disorders start to appear. अगर हमारा जीवन शैली डिस्टर्ब हो जाए, इसमें कुछ गड़बड़ हो जाए, तो lifestyle disorders start to appear. So we tend to suffer from lifestyle disorders. Number one is obesity. Obesity is the burning problem. So इस दुनिया में maybe more than 40% of the people are suffering from obesity. So obesity is a complex disease that involves an excessive amount of body fat. Obesity ऐसा condition है जहां पर शरीर में excessive, normal से बहुत ज्यादा fat accumulate हो जाए. Apart from being a cosmetic issue, it is a medical problem that increases the risk of other health problems. So ये सिर्फ cosmetic issue नहीं, ये तो एक medical problem है. So जिसके वजह से we can see so many complications of obesity like हृदरोग, that is heart disease, diabetes, high blood pressure, and certain cancers. So these are some of the complications of obesity. In Ayurveda, atisthaulia, obesity, is described as excessive accumulation of meda, that is fat या adipose tissue. So शरीर में मेदो धातु बहुत ज्यादा हो जाए नॉर्मल से, और मांस धातु भी. This leads to flabbiness of hips, abdomen, and breast. So there is a saying which goes like this: spic sthanodara lambanam. इसका मतलब है hips, then abdomen and breast, ये region flabby और saggy हो जाते हैं. Okay, it won't be firm. It is considered as one of the संतर्पणोत्थ विकारास. आयुर्वेद में तो हम कैटेगराइज करते हैं कि एक विभाग है संतर्पणोत्थ विकारास, दूसरा है अपतर्पणोत्थ. संतर्पणोत्थ विकारास ये तो ओवर नरिशमेंट से जो प्रॉब्लम्स होते हैं, इससे हम बोलते हैं संतर्पणोत्थ विकारास. एंड अपतर्पणोत्थ विकारास मीन्स डिसीजेस विच आर बिकॉज ऑफ undernutrition due to consumption of excessive calories in Ayurveda. Then medodushti, that is disorders of fat metabolism, may be one of the risk factors for ischemic heart disease. So ये शरीर में ज्यादा फैट का कलेक्शन हो जाए तो it is one of the reasons for IHD. What are the causes? Although there are genetic, behavioral, metabolic, and hormonal influences on body weight, obesity occurs when one takes more calories than he actually burns with the daily activities and exercise. So obesity का मुख्य कारण है, maybe in spite of this genetic, behavior, metabolic, and all these, obesity का कारण basically हो सकता है अगर हम नॉर्मल से बहुत ज्यादा एक्सेसिव कैलोरीज कंज्यूम करें और वो कैलोरीज को अच्छी तरह से बर्न ना करे. सो हमारा डेली एक्टिविटीज एंड एक्सरसाइज ऐसा होना चाहिए कि we burn the calories. लेकिन अगर वो बहुत ज्यादा exceed हो जाए तो that is the cause for obesity. Then lifestyle choices. So हमारा lifestyle choices, अगर sedentary lifestyle को अगर हम choose करें तो it may be one of the main reasons. Then unhealthy diet, a diet high in calories, lacking in fruits and vegetables, full of fast food and filled with high calorie beverages and oversized portions. So we all know this, isn't it? बहुत ज्यादा calories consume कर रहे, हमारे आहार में अगर फ्रूट्स एंड वेजिटेबल्स ही न रहे, या फिर वी आर एडिक्टेड टू दिस फास्ट फूड, जंक फूड, या फिर हाई कैलोरी बिवरेजेस एंड ओवरसाइज पोर्शंस, का मतलब है क्वांटिटी में ज्यादा. ओके, देन लिक्विड कैलोरीज, people drink many calories without feeling full. So this is one of the important things, especially calories from alcohol and high calorie beverages such as sugared soft drinks. हमें तो लगता है ये सिर्फ पानी जैसा है, ये पीने से क्या होगा, we are not consuming lot of fatty substance and all. No, but this high calorie liquid calories also matter a lot. They all contribute to significant weight gain. Then inactivity. Inactivity is, in sedentary lifestyle one can easily take in more calories every day than they actually burn through exercise and daily routine activities. So हमारा तो आजकल का ये प्रेजेंट आधुनिक युग में हमारा तो लाइफस्टाइल ही ऐसा रहता है, क्योंकि हमें हर चीज या फिर हर काम करने के लिए कुछ मशीन्स है, राइट? So if we take in more calories than we actually burn, that may be the cause, isn't it? Looking at computer, tablet and phone screens is a sedentary activity. The number of hours you spend in front of a screen is highly associated with weight gain. So the number of hours you spend in front of a screen is highly associated with weight gain. We are all spending a lot of time looking at the screen, isn't it? Then overeating and irregular food habits. This is one very important thing. Not having timely food is also the main cause. Then daytime sleeping. So again, this is one of the cause. So symptoms of obesity are these: breathlessness even on little exertion or physical activity, lack of interest in doing work, profuse sweating with full body odor. You remember मेदो धातु का मल है स्वेदा. पसीना is the waste product of मेदस, इसलिए शरीर में ज्यादा मेदस है तो there is profuse sweating that is associated with body odor. Excessive hunger, ज्यादा भूख लगता है, ज्यादा tiredness feel होता है, ज्यादा सोते हैं वो लोग. Then diagnosing over obesity. Though people may look obese, it's not necessary that they have to have this BMI changes. Look here, overweight and obesity are assessed using body mass index, that is BMI. It is defined as person's weight in kilograms divided by square of his or her height in meters, that is kg per meter square. Now all of you can calculate your BMI if you know your height and weight. Then healthy and normal BMI is 18.5 to 24.9. BMI of overweight is 25 to 29.9. BMI of obesity is more than 30. All of you can please calculate your BMI and then try to know whether you're obese or not. And एक और बहुत important सा calculation, that is dimension, how you know that the person is obese is waist circumference should also be used in addition to BMI to measure central obesity and disease risk in individuals with BMI less than 35 kg per meter square. Then normal range of waist circumference in men is 94 to 102. Women, it should be 80 to 88. Further, following lab investigations are recommended to assess the risk of other health related issues. Then lipid profile, blood glucose, both fasting and post lunch, preferably fasting, blood pressure. So all these are very good criteria जिससे हम obesity को measure कर सकते हैं. That means these are some of the lab investigations and some of the measurements of the body जिससे ओबेसिटी कंफर्म होता है। एंड व्हाई दिस इज नीडेड इज, ये तो हमें चाहिए कि कितना ओबेसिटी प्रॉब्लम है, और ये जानने के बाद हमें कुछ दवाइयां लेके, ट्रीटमेंट लेके, कुछ डाइटिंग वगैरह करके हम तो अगर पतले, आई मीन यू स्टार्ट बिकमिंग थिन, देन उस समय हमें प्रूफ चाहिए, एविडेंस चाहिए। सो इसके लिए ये बिफोर और आफ्टर ट्रीटमेंट हम ये सब टेस्ट कर सकते हैं। देन आयुर्वेदिक मैनेजमेंट लाइन ऑफ ट्रीटमेंट under strict supervision of registered Ayurvedic medical practitioner. This is very important. Then Shamana ya palliative treatment. So Langhan, this is number one. As you all remember, while talking about ama, I had told you Langhana is the cause of ama, or Langhana is the treatment of ama, both. So some of you were like, how, which is the cause can become the treatment? Yes, if erratic or irregular fasting is done, that can be the cause of obesity. लेकिन अगर regular, timely and planned fasting करे, तो that is the treatment. So अगर ये obesity में भी यही principle adopt करे, तो Langhana, that is fasting, which can be even intermittent or once in a week or once in 15 days, or it can be Nirjal Ekadashi, like that. How people are following Sankashti, or it can even be the rosa, or it can be the fasting followed by feasting. So all these, when done in a proper manner, this can be the cause for, this can be the treatment for obesity. Number two is Amapachan. Ama is nothing but अग्नि की कमी होने से शरीर में अनवांटेड, अनडाइजेस्टेड सब्सटेंसेस का उत्पत्ति हो जाए, एंड ये आमा डिफरेंट साइट्स में लॉज हो जाए, दैट इज कॉल्ड एज आमा। एंड इस आम का कैसे हम डाइजेस्टिव्स यूज करके कैसे हम इसे करेक्ट कर सकते हैं, सो दैट इज आमापाचन। सो इसके लिए हमें चाहिए ओरल यूज ऑफ डाइजेस्टिव्स टू ऑगमेंट फैट मेटाबॉलिज्म। Then Ruksha Udvartan, so that is dry medicated powder massage. Then heavy and non-nourishing diet or items like honey, salad, etc. Physical exercises, mental work is also recommended. Then Samshodhana Chikitsa, that is purificatory procedures like Panchakarma, Isme Vamana, and then Virechana, then Lekhanavasti, all these are advised. As I just keep on telling you about Vamana Virechana, please try to gather more information about Vamana Virechana rather than I have told you, and please try to adopt this Vamana and Virechana under proper supervision of Ayurvedic doctor. Our coordinators, organizers, they are always ready to make you consult our specialists of Arogyam team, right? Okay, so this is regarding Panchakarma. और इसके बाद yeah, same thing is repeated again. Single drug therapy, yes, there are many herbs, कुछ जड़ी बूटियां है जिसके वजह से which are very good in regulating the body fat, like guduchi, vidanga, musta, shunthi, amla, vacha, daruharidra, gugulu, etc. Compound formulations like trikatu, navaka gugulu, trifala gugulu, vidangadi churna, takrarishta, नवायासलोहा, आरोग्यवर्धिनी वटी, वेदोहर गुगुलू। देखिए ये सब तो मेडिकेटेड प्रिपरेशंस है जिसके अच्छी तरह से नॉर्मल रेगुलरली प्रिस्क्रिप्शन इसका लेने से ओबेसिटी जैसे प्रॉब्लम में बहुत अच्छा होगा, राइट? देन त्रिफला गुगुलू, या दिस इज डन। लाइफस्टाइल मॉडिफिकेशंस, ये तो बहुत जरूरी है, नॉट जस्ट डाइट एंड नॉट जस्ट medicine. हमारा activity level and other things also have to be very much proper. So mild to moderate exercise according to individual capacity. Regular habit of brisk morning walk for 30 minutes is very important. Avoid sedentary habits, avoid excessive sleep, avoid watching TV while having food, and then avoid alcohol and smoking. Avoid sleeping just after meals. And then do's, take low fat and low calorie food items, Take more proteins to stay longer without food. Steamed, boiled, or baked vegetables are to be used rather than fried. Take frequent small meals to avoid food cravings. Drink skimmed milk instead of whole milk. Take healthy foods such as oatmeal, walnuts, salads, bitter gourd, drumstick, barley, wheat, green gram, honey, Indian gooseberry, pomegranate, and snake gourd, and skimmed buttermilk. Include cabbage in daily meal. It will stop the conversion of sugars to fat. Yesterday also we have discussed about this. Use warm water for drinking. Then include lemon in diet and drinks. So all these are some of the do's that are actually very good for obesity. Then don'ts we have like high carbohydrate vegetables like potato should be avoided. And also rice, I don't say you have to avoid rice. आप थोड़ा सा कम कर सकते हो rice का quantity. Then many of you were asking why rice should not be eaten. It is not that you have to totally abstain from rice. अगर हम राइस ही प्रधानतः से मोर क्वांटिटी में या फिर मेन डिश जैसे कंज्यूम करें तो क्या होता है, राइस का क्वांटिटी ज्यादा हो जाता है क्योंकि इट इज वेरी सॉफ्ट एंड फ्लफी एंड यू फील लाइक ईटिंग मोर एंड मोर. इसलिए राइस के साथ कुछ और सीरियल्स भी अगर हम इंक्लूड करते हैं तो राइस का क्वांटिटी कम होगा, राइट. सो इट इज हाई कार्बोहाइड्रेट. Basically, rice is actually very good for health. We Ayurvedic people advocate rice, but ये इसका quantity इतना भी ज्यादा नहीं होना चाहिए कि it causes obesity, because rice ज्यादा consume करने से calories भी ज्यादा add होते ही जाता है. पुराने जमाने में तो people used to work very hard, they used to wander here and there, they used to do lot of physical work, and such people, if they are consuming rice, that may not affect their general health. लेकिन हम लोगों का तो sedentary lifestyle होता है, so stomach fill करने के लिए या फिर lethargy से अगर हम rice का ही preparation ज्यादा consume करें तो yes, definitely it might lead to lot of problems. More sugary or sweet products, more dairy products, fried and oily fast food, these have to be avoided. Excessive salt intake also, इससे वाटर रिटेंशन भी हो सकता है. सो ऑल दीज कारणों के वजह से हमें डोंट्स को अवॉइड करना है, डूज को अडॉप्ट करना है, एंड मेडिसिन शुड बी टेकन अकॉर्डिंग टू द प्रिस्क्रिप्शन ऑफ registered Ayurvedic medical practitioner. And always I would advise you to go for classical Vamana, Virechana, Lekhan Basti and all these, right? So saying this, let me just move on to the next, that is hypertension. Hypertension is a condition जहां पर blood pressure is high. So hypertension, also known as high blood pressure, is a long-term medical condition in which the blood pressure in the arteries is persistently elevated. So as I told you, the blood which is moving constantly in the body, blood is pumped by the heart and it is carried to different parts of the body by ब्लड वेजल्स. ये ब्लड वेजल्स के वॉल्स जो है, ये वॉल्स पर जितना फोर्स एक्सर्ट करता है ब्लड, दैट इज कॉल्ड एज एक्चुअली द प्रेशर. अगर प्रेशर मोर इज एक्सर्टेड ऑन द वॉल्स बाय द ब्लड, दैट इज कॉल्ड एज हाई ब्लड प्रेशर. सो हाई ब्लड प्रेशर इज क्लासिफाइड एज primary, that is essential hypertension, or secondary hypertension. So अगर ये blood pressure arteries में persistently elevated रहे तो that is a condition called as hypertension. About 90 to 95% of cases are primary. They are defined as high blood pressure due to non-specific lifestyle and genetic factors. Lifestyle factors that increase the risk include excessive salt in the diet, excessive body weight, smoking and alcohol use. The remaining 5 to 10% of cases are categorized as secondary high blood pressure, defined as high blood pressure due to an identifiable cause such as CKD or chronic kidney disease, narrowing of kidney arteries and an endocrine disorder, or usage of birth control pills. See, the secondary hypertension is basically very less in number. ऐसे कारणों की वजह से अगर हाइपरटेंशन हो जाए तो दैट हैज टू बी मैनेज्ड क्लिनिकली बेसिकली ओनली बाय अ स्पेशलिस्ट। लेकिन ये 90 to 95% ऑफ द केसेस आर बेसिकली प्राइमरी, एंड ये तो हमारे रॉन्ग डीड्स से भी हो सकता है। Then, for most adults, normal blood pressure at rest is within the range of 100 to 130 millimeters of mercury systolic and 60 to 80 mmHg diastolic. So systolic is what we write in the numerator and diastolic is what we write in the denominator. For most adults, high blood pressure is present if the resting blood pressure is persistently at or above 130 by 80 or 140 by 90 mmHg. So this is again another form. Then come, let us have a look at the different values here. देखिए, first column है blood pressure category, second column है systolic millimeters of mercury upper number, and the last is diastolic millimeters of mercury lower number. So blood pressure category number 1, it is normal है तो within range होना चाहिए, that is less than 120 systolic and less than 120 diastolic. Elevated है तो how much it will be, 120 to 129 and less than 80. High blood pressure hypertension stage 1 is 130 to 139 or 80 to 89. Then high blood pressure stage 2 is 140 or higher or 90 or higher. Hypertensive crisis, consult your doctor immediately if it is more than 180 and this diastolic is higher than 120. ऐसे condition है तो it is yes considered as hypertension. देखिए, according to Ayurveda, hypertension is correlated to रक्तगतवात. So ये तो बहुत नया डिसीज तो नहीं, लेकिन इसका ये फ्रीक्वेंसी या फिर इसका what to say number was not so much in olden days because there was no stress probably. Yes, come on, let us have a look at the causes. Heavy, oily, acidic, pungent tasting meals ज्यादा लेने से blood pressure हो सकता है. Excessive eating, too much eating, normal से ज्यादा, हमारे capacity से बहुत ज्यादा अगर हम खाए तो it can lead to hypertension. Alcohol intake, yes, this is one of the reasons. Also smoking. Then acidic and hot potency food, ये भी नहीं लेना चाहिए हमें. Excessive sweet taste भी नहीं खाना चाहिए. Sedentary lifestyle is one of the main causes because we tend to lack that ability to adapt ourselves to specific environment अगर हमारा lifestyle बहुत sedentary रहे तो. Then day sleep to be avoided, yes, smoking again. So ये सब कारण के वजह से क्या क्या हो सकता है, what all would happen. Look at this, this is संप्राप्ति. संप्राप्ति का मतलब है पैथोलॉजी. कैसे ये कारणों के वजह से हमारे शरीर में कैसे ये ब्लड प्रेशर जैसे प्रॉब्लम या फिर ये पैथोलॉजी हो सकता है. Come, let's have a look at this. निदान सेवन is nothing but the causes ज्यादा हो जाए तो there will be tridosha prakop, that is all the three doshas would increase in the body, aggravate, they get aggravated in the body. इसके वजह से मन क्षोभ, that is our mind gets agitated, जिसके वजह से कफा या मेद की वृद्धि. So kapha is the one of the doshas and medas is nothing but one of the dhatus of the body. So kapha dosha and medo dhatu, these will be deranged. धमनियों में स्थान संशय, so इसके वजह से the kapha and meda they get accumulated and they line the inner lining of the arteries, blood vessels. Then इसके वजह से there will be margavarodha. What is this margavarodha? It is nothing but the obstruction in normal movement. So marg का मतलब है road and avarodha is obstacle. This forms as an obstacle in the basic passage of the blood. धमनियों में स्थान संशय. So धमनियों में स्थान संशय is the cause for this margavarodha. इसके वजह से there won't be enough space for the blood to flow properly. So there will be Vata Prakopa. So as I told you, Vata is of 5 types, and the Vata that is associated here in the circulatory system and this cardiovascular system, this part is Vyana Vayu. So Vyana type of Vayu is basically aggravated, and then इसके वजह से व्यानवायु द्वारा रक्त के साथ मिलकर, so व्यानवायु along with blood, रक्त संवहन की मिथ्या गति, there will be imbalance or improper movement of the blood, and this is the leading cause for रक्तगतवात. So रक्तगतवात के लिए ये सब कारण हम देख सकते हैं. And this is the general process, like how the problem arises, right? So इसका treatment है क्या कुछ? Yes. Number 1 is Shodhana Chikitsa, that is Virechana Karma, which is called as medicated purgation. Then Lekhana Basti, Rakta Mokshan, that is bloodletting. These can be some different forms of Shodhana Chikitsa. And then Shamana Chikitsa are like single herbs. Arjuna, you might have heard of this. There is a tree by name Terminalia Arjuna. Is Arjun tree ka chal, that is bark, is considered for usage. ये अर्जुन ट्री का bark से हम क्षीर पाक बना सकते हैं. We can make क्षीर पाक, that is addition of अर्जुन का छाल का कषाय बना के इसमें कुछ क्षीर ऐड करके उबालना. So boiling that is called as Arjuna क्षीर पाक. Also Sarpagandha. So Sarpagandha is Rauwolfia serpentina. This is a very nice plant whose roots are used, or modern ka reserpin is extracted from this Sarpagandha itself. And then Bhringaraj. You might have heard about Bhringaraja being used for hair, but it is also very good for this type of problem also. Jathamamsi. What is this Jathamamsi? It is a very aromatic root, aromatic rhizome, I can say, which gives a very tranquilizing effect. Shankhapushpi. Yes, Convolvulea, it is a climber belonging to this family. So Shankhapushpi is Clitoria ternacea, and the Convolvulaceae family का एक member है ये. So इसका तो conch जैसा different colors वाला flowers रहते हैं. And then it is Punarnava. Punarnava is, why the name Punarnavaha? Punarnava is Punaha Navi Karoti. So again and again it helps you in rejuvenating. The cells get rejuvenated. So different cells में इसका action, and also kidney को ये cleanse कर देता है. So this is Punarnava. And Lashun. Lashun means it is garlic. We all know that. Rudraksha, Guduchi, Shatavari. Guduchi is Giloy, and Shatavari is, we all know it is Asparagus racemosus. इसका मूल बहुत important है. So these are some of the single herbs that can be used. And churna, ready preparations are like Sarpagandha ka churn, Svirasta churn vati pill, Sarpagandha, Prabhakar vati, then Chandra Prabhavati, then Asavarishtas are like Arjunarishta, Punarnavasava, and some of the herbomineral preparations like Praval Pishti. So all these are very good treatment formulations, and these formulations are generally used for improving the condition. Okay, then there are some yogasanas which can be adopted. So child pose, that is Balasana, Sukhasana or easy pose, Shavasana, Cobra pose, that is Bhujangasana, Bridge pose या फिर सेतुबंधासना. और इसके साथ कुछ प्राणायाम बहुत इंपॉर्टेंट है. अनुलोम विलोम प्राणायाम, भ्रामरी प्राणायाम, शीतली प्राणायाम, शीतकारी प्राणायाम, and Om chanting. So these have to be adopted for practicing every day. So that would be great. Then, so this is about hypertension. So इसे हम रक्तगतवात या फिर रक्तचाप भी कहते हैं. So this is regarding this. Next disease that we would take up is diabetes. So the 3 metabolic disorders, I can say the 3 lifestyle disorders are covered today itself. So diabetes mellitus, also known as diabetes, is a metabolic disease which causes high blood sugar. So diabetes is a condition जहाँ पर हमारा रक्त, so in the blood there would be good amount of free glucose. The hormone insulin moves sugar from blood into your cells to be stored or used for energy. This is normalcy. एक हार्मोन है, इसका नाम है इंसुलिन, और ये सेक्रेट होता है हमारा पैंक्रियास, islets of Langerhans. इससे ये हार्मोन by name insulin is secreted. It moves sugar from blood into your cells to be stored or used for energy. With diabetes, your body either does not make enough insulin or it can't effectively use the insulin it makes. So diabetes तो ऐसा condition है जहाँ पर इंसुलिन ही अच्छी तरह से फॉर्म नहीं होगा, या फिर इंसुलिन है लेकिन हमारा बॉडी तो, हमारा सेल्स तो इसका रिकॉग्निशन ठीक तरह से नहीं कर रहे हैं. So this is the condition. Untreated high blood sugar from diabetes can damage your nerves, eyes, kidneys, and other organs. So these are some different reasons or different ways how you can interpret this diabetes. So diabetes, initially it is not so very much complicated, lekin if we neglect it, it definitely leads to fatal things. So इसलिए बोलते हैं कि अगर आपको डायबिटीज ऐसा डायग्नोस हो गया है तो ट्रीट इट लाइक ए फ्रेंड. इफ यू डोंट ट्रीट इट लाइक ए फ्रेंड, then it will become your worst enemy. Treat it as your best friend or it will become your worst enemy. So there are a few different types of diabetes. Type 1 diabetes is an autoimmune disease. The immune system attacks and destroys cells in the pancreas where insulin is made. It's unclear what causes this attack. About 10% of the people with diabetes have this type. See, इसमें पहला वाला, the first type is said to be an autoimmune disease. Next, type 2 diabetes occurs when your body becomes resistant to insulin and sugar builds up in your blood. So type 2 diabetes occurs when your body becomes resistant to insulin. So this is actually what most of the people suffer with. And what is this pre-diabetes? Pre-diabetes occurs when your blood sugar is higher than normal, but it's not high enough for a diagnosis of type 2 diabetes. So that is pre-diabetes. Next is gestational diabetes. This is a high blood sugar during pregnancy. Insulin blocking hormones produced by placenta cause this type of diabetes. So this is gestational diabetes. And then see, कभी कभी ये gestational diabetes तो after delivery कम हो जाते हैं, right? Then meaning of blood glucose. Let us look at this table. Blood glucose levels is the first column, which is expressed in mg per dl, that is milligrams per deciliter. Blood glucose levels is mmols per liters. और इसका interpretation, that is a third column. Let us see. If blood glucose level is less than 53 mg per dl and it's less than 3 mmols per liter, then it is severe hypoglycemia. If it is less than 70 and less than 3.9, it is hypoglycemia. Less than 125 and less than 7, it is normal. Less than 200, less than 10, it is high, take action. 200 to 500 is 10 to 27.7, then metabolic consequences. So take action. So these are some of the important interpretations. And look at this HbA1c score. So what is this HbA1c score? It is basically the glycosylated hemoglobin का a measurement है, and it is a condition wherein it gives a general clue regarding 3 months average of this. Number 1, HbA1c test score अगर 4 to 6 है तो excellent control, then that means 50 to 115 mg per dl would be the mean blood, and then glucose is 2.6 to 6.3. It's good if it is 7 and 8, 150 to 180, and then 8.2 to 10 glucose. Then it is poor if it is from somewhere between 9 and 14, 215 to 380, and then 11.9 to 21.1. So this is the slide. You can just go through this. So in Ayurveda, a condition in which a person passes honey-like sweet urine is called as madhumeha, and the condition is correlated to hyperglycemia. Then reduced insulin production and decreased insulin sensitivity are the contributing factors for hyperglycemia. So as we discussed, insulin कम होना या फिर insulin को पहचानने में failure, these can be the causes for hyperglycemia. It is one among 20 types of prameha described in various Ayurvedic classics, that is Charaka Samhita, Sushruta Samhita. Then ancient seers have narrated that excessive use of heavy to digest food, unctuous food, sour food, salty food, these can be the causes. We often think that it is only sweet zyada consume karne se ye sweet urine disease hoga. So it is not so simple. Sour or salty zyada consume karne se bhi ye ho sakta hai. Then navana is food prepared from newly harvested grains. So that has to be avoided, because always remember, only in Hemant Rutu, only in this early winter season may navana is advised. New wine is to be avoided. Asya Sukha is sedentary lifestyle. Ati Nidra is excessive sleep. Avyayama, that is lack of exercise. Achinta is lack of mental exercise also. Not just physical exercise. Mind को भी कुछ हम व्यायाम, कुछ food for thought देना पड़ेगा. Always having a very aram free mindset, that also might be the cause. Remember, abstaining from samshodhana. Nowadays, most of the people are not at all knowing about this purificatory therapy. So these are the causes of madhumeha. Then clinical features: increased frequency of urine, that is polyuria, increased appetite, polyphagia, excessive thirst is polydipsia, turbidity in urine, that is cloudy urine, and then debility or tiredness, then weight loss, non-healing ulcer. So it so happens that sometimes, especially lower parts of the body में कुछ ulcers या कुछ wounds हो जाए, it does not heal well. So that is non-healing ulcer. Then visual disturbances, देखने में कुछ problem, and then inflammation of glands penis, especially seen in males. That is how it is detected most of the times. In later stages of diabetes mellitus, the following complications may appear, like burning sensation, that is neuropathy over palmar and plantar region, that is region में, this is called as palmar region. The same part in the legs, that is foot के नीचे का भाग, that is plantar aspect. इस regions में कुछ जलन दिखाई देती है. And then boils and carbuncles, many boils in different parts of the body, and sometimes even gangrene. So what is this gangrene? Gangrene तो ऐसा problem है जहां पर especially it happens in lower extremities, legs में. So अगर blood supply कुछ regions में अच्छा नहीं है, such regions are prone to this gangrene. Then general debility, that means generalized weakness. Retinopathy, eye-related disease. What is this retina? Retina is the one which is very important for proper vision. So retina, that is inner part of the eye, में कुछ problem हो जाए. Pathological features, if they are seen, it is called as retinopathy. Then renal tissue damage, that is nephropathy. So this also can be one of the causes, or sorry, one of the complications. Kidney का कुछ problem. Then cardiovascular disease, heart का कुछ problems. So अगर diabetes control में नहीं है, तो it leads to heart problems, kidney problems, eye problems, circulation related problems, non-healing wounds and ulcers. So many things, isn't it? Next, investigations, disease specific investigations, measurement of plasma glucose level. So random blood sugar, that is RBS, fasting blood sugar FBS, postprandial blood sugar is PPBS. So random is generally कभी भी अगर हम test करें तो that is called as random. Fasting is early morning on empty stomach, that is fasting. PPBS is खाने के बाद 1.5 hours. Okay, so 1.5 to 2 hours. So that is PPBS. Then urine routine and microscopy. So general urine related tests and कुछ microscopy. अगर urine में कुछ glucose का अंश detect हो जाए, so that can be the thing. And then glycosylated hemoglobin is 3 months average, as I told you. So this is generally done. Then lipid profile. So कैसा है इस व्यक्ति का cholesterol part. So that is known by this lipid profile. So these are some of the very important tests that are usually done. So let us see how हम prevent कर सकते हैं इस problem को. Use of various preparations made from barley, that is yawa, mudga, that is green gram, old rice, bitter gourd, drumstick, methi is fenugreek, patola, snake gourd, pumpkin, cucumber, bimbi, watermelon. Bimbi is nothing but ivy gourd, watermelon, buttermilk, triphala, etc. These are beneficial as preventive measures for borderline diabetic patients. Number 2 is अच्छी तरह से हमारा daily routine होना चाहिए. Daily regimen should be very good. Get up early in the morning, do all the rituals properly, and then Rutucharya, seasonal changes, how they are going to affect the body, और इसके लिए हमें क्या क्या करना होगा. All these come under Rutucharya. Number 3 is regular exercise, increase in calorie consuming activities like brisk walking, swimming, and all these. Regular use of rasayana drugs like amalaki rasayana, etc. Then restriction in intake of sugar or sugar products, fried food and dairy products. So there has to be a control over all these. And remember, these rasayana drugs are like amalaki, that is Indian gooseberry, giloy, so many things. All these are very helpful. They improve the quality of rasadhatu to shukradhatu, all these. Okay, so such drugs are called as rasayana drugs. Restriction in use of different types of wine, excessive use of oil, clarified butter, milk, sugarcane products, all these, meat of domestic and aquatic animals and all these. Then avoidance of day sleep and laziness. So all these are generally done for prevention. So prevent तो किया, अगर इतना सारा prevention करने के बाद भी कुछ line of, कुछ diseases का manifest हो जाए तो we will have to know about the basic line of treatment. So it is not that once a diabetic, always a diabetic. That is to some extent true. Lekin definitely we can manage this disease very well, not to lose hope. If anyone becomes a diabetic, life expectancy need not be very less. Do not think so that we are nearing to death. Nothing like that. If you are able to manage it very well, with diabetes, people live up to many decades also. Nowadays, so juvenile diabetes bhi detect hota hai, that is a very early stage in a very young age. So such people are also able to live up to 60-70 years with proper management. If diabetes is diagnosed at a later stage also, if proper care is taken, people can live for more than 35 to 40 years after detection. Okay, so with proper care. Okay, right. Line of treatment. Nidan Parivarjan, that is avoidance of etiological factors. So क्या क्या avoid करना चाहिए हमें? Avoidance of tubers. भूमि के अंदर जो भी vegetables या ऐसे yams या tubers grow होते हैं, वो सब avoid करना है. Tubers, lots of sweets to be avoided, dairy products also. soft drinks, fried foods, and sweet fruits like mango, banana, custard apple, all these should be avoided. So too much consumption of all these may lead to this problem. Then number 2, if patient is obese, then samshodhana chikitsa, that is bio-cleansing therapies, have to be adopted in the form of Vamana, Virechana, Vasti, all these. However, this need to be decided by the qualified physician of Ayurveda. If patient is lean and thin, then only Shamana Chikitsa, that is palliative therapy, is recommended. So, कब ये cleansing therapy has to be adopted and कब ये pacificatory treatment to be adopted, that will be decided by the physician, seeing the complicatedness or the stage. Then number 3 is drug therapy. In Ayurveda, most of the drugs indicated in diabetes mellitus may act on beta cells of Langerhans, thus improve insulin production, insulin sensitivity. The following drugs or formulations are useful in controlling type 2 diabetes mellitus. In case of type 1 diabetes, the drugs formulation can be supportive. So, not necessary to think whether Ayurvedic drugs are useful in type 1 or type 2 and all these. Even type 1 may be इंसुलिन के साथ कुछ प्रॉब्लम्स कुछ कॉम्प्लिकेशंस को दूर करने के लिए या फिर एज अ फॉर्म ऑफ सपोर्टिव रेमेडी, डेफिनेटली दीज कैन बी यूज्ड. देन लॉन्ग टर्म कॉम्प्लिकेशंस को कम करने के लिए. देन दीज आर सम ऑफ द वेरी फ्यू very useful single drug therapies that have been mentioned in Ayurveda. They are like amla, that is Indian gooseberry, which is botanically identified as Phyllanthus embolica. Next it is turmeric. So turmeric is haldi. Next is jambu, that is Syzygium cumini. Meshashringi is Gymnema sylvestre. Methi is Trigonella phoenicum या फिर Trigonella graecum. Vijay-Sara is Pterocarpus marsupium. Karela is Memordica charantia. So these are some of the single drug preparations. There are some formulations that are really very beneficial and they are like निशामलकादि चूर्ण. ये तो कुछ और नहीं है. निशा का मतलब है हल्दी, आमलकी का मतलब है amla. So one part of nisha with 2 parts of amalaki, these are to be mixed properly, the powders. So this is a very good combination for diabetes. Triphaladi churna is the combination of 3 fruits, that is haritaki, vibhitaki, amalaki, that is harde, baheda or amla. Number 3 is Chandra Prabhavati. So Chandra Prabhavati, which consists of very important ingredient called as Shilajatu. So that is very useful. Then Shuddha Shilajatu, that is also very useful. Phalatrikadi Kwatha. Phalatrikadi Kwatha again consists of Triphala plus many other drugs. So this is about diabetes mellitus. Not just this. Yes, definitely we have lots and lots of other home remedies which generally people are following already. For example, home remedies like methi. Methi is soaked overnight, that can be consumed in the morning. Number 1. Curry leaves को grind करके हर रोज buttermilk के साथ लेना, that is number 2. Number 3 is Nucool. You all know that Nucool. It is a turnip like. So using Nucool regularly along with mooli, that is Raphanus sativus, radish. This is a very good form. Then adopting certain techniques like using this barley. Barley means it's available in provision shops. Hordeum vulgare is one of the names, botanical names of this barley. So using that is really a very good treatment in this. It can be mixed with the chapati flour या फिर dosa flour, इडली के साथ भी mix कर सकते हैं. So ये लेने से there will be virukshana of the body. Again, that's a very good form of treatment in diabetes. And apart from this, any other Ayurvedic medicines can be adopted under proper supervision of a registered Ayurvedic medical practitioner. So we have given many of the tips, health tips, and also this treatment related. Yes, you can adopt all these. Right. Now we have completed the class. I'll just take up one or two questions. Prithvi is asking, when we take amla juice, can we make it lukewarm water? Make it in, that can be made, but do not heat amla directly. Hema Madhwani is asking, what is Nidana Parivarjan? Yes, as I told you yesterday, I think you were not there yesterday, isn't it, Hema? Nidan ka matlab hai cause. Parivarjan means withdrawal या फिर avoiding. So जो भी disease के लिए causes detect होते हैं, those have to be avoided. That is निदान परिवर्जन. And then Anisha Verma is asking, is methi soak useful in thyroid too? To some extent, but it is very helpful in sugar conditions. Then Sadhana Rajkumar is asking, is it necessary that we by heart the botanical names of fruits and vegetables? It's not necessary to learn by heart. You can just have a copy of that. It's better if you can learn. Okay. Yes, this completes our class. I hope it was of some use. I would request all of you to please go through the slides and watch the recording again. If at all you haven't followed anything in the recording, you will find explanation. So yes, all of you, please read every day, make your own notes. Okay, you just try to gather as much of information from website, and also there is a site called as easyayurveda.com, which is very helpful in improving the information, quality information you will get. See, in Google you will get sometimes many things which are not at all fit to be recorded or saved, but there are some websites which give genuine information, especially for Ayurveda. It is easyayurveda.com, right? So you can do this. Okay, thank you so much. It's time up. Myself, Dr. Pratibha, I will be ending the class today. Thank you all for your patient hearing. So myself, Dr. Pratibha, signing off. Read well. Thank you. Namaste.